A woman who had become bedridden after years of battling multiple autoimmune diseases has recovered dramatically following experimental treatment known as CAR T-cell therapy. This case is drawing attention because the therapy, originally designed to treat cancer, appears to have effectively reset the person's immune system, allowing her to recover from illnesses that had resisted nearly every available treatment. Hello and welcome to The Print. My name is Soumya Pillai and you are watching Pure Science. A 47-year-old woman in Germany had been suffering from 3 serious autoimmune conditions at the same time: autoimmune hemolytic anemia, immune thrombocytopenia, and antiphospholipid syndrome. In autoimmune hemolytic anemia, the immune system mistakenly attacks and destroys red blood cells. Immune thrombocytopenia involves the destruction of platelets, the blood components that help stop bleeding, and antiphospholipid syndrome increases the risk of abnormal blood clots forming inside blood vessels. These 3 conditions together can be life-threatening. Because of her complicated medical history, this patient required frequent blood transfusions. This was because her body was destroying red blood cells faster than they could be replaced. She also had to remain on blood thinning medication to prevent dangerous clots caused by antiphospholipid syndrome. Despite undergoing 9 different treatments, doctors were unable to bring the disease under control. Over time, her health deteriorated to the point that she was largely confined to bed. With standard therapies failing, doctors turned to an experimental approach using CAR T-cell therapy. The treatment represents one of the most advanced forms of immunotherapy and has already transformed the treatment of certain blood cancers. But in recent years, researchers have begun investigating whether the same technology could be used to treat autoimmune diseases. To understand why this therapy might work, it helps to look at how the immune system functions. The immune system relies on different types of white blood cells to identify and eliminate threats such as viruses and bacteria. Among these cells are T cells, which act like soldiers that can directly attack infected or abnormal cells. Another type, called B cells, produces antibodies that help the immune system identify targets. In autoimmune diseases, this defense system goes wrong. Instead of recognizing harmful invaders, the immune system mistakenly identifies parts of the body as threats. In many autoimmune disorders, the problem begins with malfunctioning B cells that produce antibodies attacking the body's own tissues. CAR T-cell therapy attempts to eliminate these malfunctioning immune cells. The process begins by removing T cells from the patient's blood. Scientists then genetically modify these cells in the laboratory so that they produce a special receptor called the chimeric antigen receptor, or CAR. This engineered receptor allows the T cell to recognize a specific molecular marker on target cells. Once the cells have been modified, they are multiplied to create millions of copies and then infused back to the patient's bloodstream. The engineered T cells can now identify and destroy cells carrying the target marker. In cancer treatment, CAR T cells are designed to recognize proteins found on cancerous immune cells. But in autoimmune diseases, the therapy is used to target B cells, the immune cells responsible for producing harmful antibodies. By eliminating these problematic B cells, scientists hope the immune system can essentially rebuild itself without faulty components that cause the disease. In the German patient's case, the treatment produced rapid results. Within about a week of receiving infusion of engineered T cells, doctors found that she no longer needed blood transfusions. Her blood counts began stabilizing and the autoimmune destruction of blood cells appeared to stop. Over the following weeks and months, the woman's health improved dramatically. She regained strength, resumed normal activities, and no longer required the intensive medical support she had previously depended on. More than a year after the treatment, she remained free of symptoms and no longer needed the medication that had once been essential to manage her illness. Researchers monitoring the case observed that the therapy had effectively wiped out the patient's B cells. After some time, new B cells began to appear again in her body. But these newly formed cells behaved normally and did not trigger the destructive immune response seen before treatment. Now, scientists often describe this effect as immune reset. Instead of continuously suppressing the immune system with drugs, which is the usual approach in autoimmune disease, the therapy attempts to remove the faulty immune cells entirely and allow the immune system to rebuild from scratch. This idea has gained increasing attention in the recent years. A number of small studies have suggested that CAR T cell therapy may be able to induce long-lasting remission in severe autoimmune diseases that do not respond to conventional treatments. Some researchers believe the approach could eventually be applied to conditions such as lupus and other autoimmune disorders, where harmful antibodies play a central role. At the same time, scientists emphasize that the treatment remains experimental for autoimmune diseases. Most of the evidence so far comes from small studies or individual patient cases like this one. Larger clinical tests will be needed to determine whether the cells work consistently across many patients and whether the benefits last over a long time. There are also practical challenges. CAR T therapy is complex and expensive because each treatment must be customized using a patient's own immune cells. Producing these engineered cells requires specialized laboratories and highly controlled manufacturing processes. It is also important to note that the therapy can also cause serious side effects. Because the treatment powerfully activates the immune system, some patients can experience strong inflammatory reactions or neurological complications. For this reason, CAR T cell treatments are usually performed in specialized hospitals where patients can be closely monitored. Even so, the remarkable recovery seen in this patient highlights the growing potential of cell-based therapies. Instead of relying only on drugs to manage symptoms, researchers are now exploring ways to reprogram the immune system itself. If future studies confirm these early results, CAR T cell therapies could represent a major shift in how autoimmune diseases are treated, offering the possibility not just of controlling the disease, but of resetting the immune system and restoring long-term normal immune function. That is all from me this week. I am Soumya Pillai, and this was Pure Science.